Hi, hello, namaste. Welcome back to our channel. My dear students, so before going to discuss, don't skip my video because the very important topics I am going to discuss. This is a very basic terminology for the medical course or GNM or B.Sc or M.Sc, whatever it may be in our nursing courses. So, medical terminology you must understand. If you understand the medical terminology, and you can read yourself whatever the subject you are going to do. So here you can see here that the different kinds of the terms are there. The pre is nothing but before. Okay, so for suppose pre-operative, in the sense before surgery. If you want to tell in the medical terminology, pre-operative, before the surgery, what are the things is going to happen, the medical terminology we can call as pre-operative. And post is nothing but, for example, so post-operative, after surgery is called as post-operative. It is a general, after surgery is a general English, where you can see in the medical terminology you can say the post-operative. And next I can say ante, nothing but before. Re is nothing but again. You can see English word is again, but in our medical terminology repeat is nothing but again and again it will come. And retro is nothing but revert back. For suppose after the delivery of the woman, the uterus might be, sometimes it will go for retrovert. The uterus will be happen retrovert, in the sense that uterus is going to backward. So that, like, we can say. So next one is neo. Neo is nothing but new. Is it? For suppose neonatal. So neonatal is nothing but new baby. So that is a neo. Next one is chronology. Chronology is in our medical terminology. Chronology is nothing but order wise, number wise, like 1, 2, 3, not a zigzag manner. It is a chronology like that. And tachy and brady. As you can see, tachy is nothing but faster. Brady is nothing but slow. As we can see, tachycardia, the heart rate is going to increase. A lot of the students is getting confusion tachycardia and bradycardia. So tachycardia is nothing but when the heart sound is going to increase, the heartbeat is going to increase, we can call as tachycardia. Whereas the heart sound is going to decrease, that will be called as bradycardia. So this is the main terminology we can see. And these are the few terminology, the surgical terms, especially in the operation theater we can use. The first one is otomy, or next one is octomy. Octomy is nothing but the cutting and removing. For suppose appendectomy. What is the meaning of here appendectomy? Appendectomy is a surgical procedure. Whilst there is a appendix, we are going to cut and we are going to remove. So that in that case we can use this octomy or atomy. And next one is ostomy. Like for suppose colostomy. Ostomy is nothing but when there is a narrowing, when there is a block. In such case, if you want to open and see what is exactly the things is going to happen, in such case we can call as ostomy. For example, colostomy. And next one is plasty. For suppose I can say rhinoplasty. What is the meaning of rhino? Rhino is nothing but nose. So this kind of the plastic surgery, when we are doing plastic surgery, if there is some shape we need to be set right, so that case we can use this plasty and all. So this is the main medical terminology where we can use the medically and surgically also. So these are the important terminology. As some of the medical terminology also we can see. The first one is amnesia, nothing but loss of memory. When someone is losing their memory, in our medical terminology we can use a amnesia. And second one is a anorexia. So loss of appetite, when they are not getting hungry, when they are not getting to eat feel, so in that case we can call as anorexia. My dear students, these are the very important bits for the competitive exam. They will tell what is the meaning of anorexia, they will give the option, but in that case you must know what is the meaning of anorexia, nothing but loss of appetite. And next one is alopecia, nothing but loss of hair. When the hair fall is going to happen, especially when the patient on the radiotherapy, in the case of cancer, in such case the patient will get this alopecia as a symptom. And next one is ageusia, is nothing but loss of taste. In some kind of the neurological problem, the peoples will get this kind of the problem, is nothing but loss of taste. And next one is hyposthesia, nothing but loss of sensitivity. So when there is not having such a kind of the sense, that is called as loss of sensitivity. And next one is insomnia, loss of sleep. When the patient is having any kind of the mental problem, stress or anxiety, they won't get sufficient sleep. So that is called as insomnia. Next one is anomsia, nothing but loss of smell. So when there is a problem in the rhino, the nose, the brain. In such case, there is a loss of smell also we will get. So my dear students, so these are the medical terminologies, a basement. If you want to study all the departmental subject, pediatric or OBG or community, whatever the things, these are the main terminology you must know. So these are the very important things I have explained today. Today's session is very important for the nursing students, especially GNM or B.Sc, those who are freshers, those who are entering for your new professional course. So see, complete the video, you will understand what is the medical terminology. And next session I am going to explain the 3D explanation of each and every organ system in the human body. So get ready my dear student for the next session. Until that, stay tuned with us, like and share and subscribe. Thank you so much for observing us. Thank you.